Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. This week, the Whole Health Report, sponsored by Empire Blue Cross Blue Shield, is back. Today, we have a new guest from Empire, Laura Brosen. Laura is a registered nurse and a clinical quality program director for Empire. Our special guest today is no stranger to BronxNet. Dr. Denise Nunez specializes in pediatric critical care at Montefiore. Welcome, ladies. Thank you so much for joining us today.
Great to be here.
Thank you for having us.
Of course, wonderful having you both. Today, we are discussing a chronic condition that disproportionately affects people in the Bronx. That chronic condition is asthma. Laura, can you help us set the stage for our discussion on asthma today?
Yes, Sanjay, as you said, this is a really important topic. Asthma has a significant impact on health of those in the Bronx. The Bronx has the highest incidence of asthma and the highest hospitalization rate for children, not only just in the 5 boroughs, but actually the highest rate of hospitalization in all of New York State. We know that the Bronx has been called Asthma Alley because of the environmental factors that can trigger asthma attacks. And as we consider our mission at Empire to materially and measurably improve the health of the communities we serve, we hope to give some information and resources today to help those better manage their condition.
Absolutely. Thank you so much for that, Laura. And this is why we appreciate this partnership with Empire Blue Cross Blue Shield to get this information out there for our viewers. Dr. Nunez, Laura mentioned that the Bronx has the highest incidence of asthma. Why is there so much asthma in the Bronx and in our borough? Can you help us understand this?
Absolutely. So just to recap a little bit, so asthma is a chronic long-term disease of the lungs that causes the airway to get inflamed and narrow and make it very difficult to breathe. This disease requires a long-term follow-up and treatments. The exact cause of asthma is unknown, but one thing we do know is what triggers an asthma attack. And the Bronx is number one in each and one of these triggers, like 1, poor quality of air from pollution. So the Bronx has some of the highest, poorest air quality in the city. The second trigger is poverty. The Bronx is the poorest county in the United States with the worst housing conditions, exposing our patients to high rate of allergens like particles like cockroaches, mice, dust, mold, etc. The other condition is also if you have another medical condition that triggers having asthma, and obesity it's very prevalent, it's very high. We have a high incidence of obesity in our children and adults in New York, and most of our patients are obese, have asthma. So, the Bronx just kind of becomes that perfect place to have asthma, which is sad, but it's true.
Very sad. And I can only imagine that, the pandemic, COVID-19 has exacerbated that, right, doctor? If you can just add a little bit on that.
Absolutely. Not only that, also not only it exacerbated that, but exacerbated how bad we treat our asthma, how a lot of our patients were not able to get access to care. And the kids were at home and they were having severe attacks. The parents were very afraid to go to the ER and have our patients treated. So thankfully with some telehealth that helped us and education helped us tell parents what they needed to do and send them medications to the pharmacy to make sure that the patients had the medication at the right time.
Absolutely. I think, highlighting preventative care is super important. And that's why we appreciate having this relationship as well with our doctors in our community. Absolutely. I wanted to focus also a little more on the specific environmental factors that contribute to asthma. Laura did mention that, where I live here in the Bronx in Mount Haven, there's a place called Asthma Alley because it has some of the worst air pollution levels in the U.S. Can you help us understand exactly what those air pollutants are and, define health disparities in the Bronx?
So what happens? So we breathe at least, let's say, if you're an adult, you breathe about 12 times in a minute. And if you're pediatric patients, you breathe about 60, right? So anywhere from 60 to 12 or 12 to 60. And every time you take a breath, you take about 8 ounces of air. And that air has oxygen, nitrogen oxide, has carbon monoxide, carbon dioxide. So a whole bunch of substances plus particles. And these particles, the ones that are the smallest ones, are the ones can go deeper into our lungs. And these are about 3 to 5 micronons. And what happens is that all these particles that we have from the traffic, from dust, from Poland. All these particles are very tiny, only 2.5 in diameter. So they go all the way into our lungs, and they produce this inflammation, this irritation in your lungs. And what does the lungs do? They actually close. Why? You don't want all these substances coming in, or these particles coming into your lungs. And that's like a compensatory mechanism that the lungs have. And that triggers asthma. And what happens with our Bronx population is, because we live in this land of with all these air pollutions, with all these allergens, we don't have a place. The kids don't have a place to go and play. They don't have these clean parks. You go out of your house and you have the streets right there. You have the highways right on top. You have the train on top of you. So this helps for us to have an unsafe environment for our families that live here in the Bronx.
Well, thank you for breaking that down, doctor. So, for someone who's not aware, what are the symptoms that we should look out for when it comes to asthma?
Definitely. So different symptoms can be from mild to very severe, starting with even just having like a little sore throat or some runny nose, going into coughing and chest pain and difficulty breathing. And I always tell my parents that you have to be aware of these symptoms, because sometimes it just starts with a little simple cough, especially with older kids, the teenagers. They're really hard to treat, right? They're really strong. Sometimes they don't want to follow, orders and things like that. And the bad things with the teenagers that actually collapse very easy. They tend to be like, okay, until they're not okay. So they go from coughing a little bit until they collapse because they can't breathe. So knowing little triggers of your kids, when you hear them cough a little bit, or something in their throat, or having a little bit of difficulty breathing, or breathing a little bit fast, is very important to know. And right away, either use your inhaler or call your pediatrician and let them know that something is happening to your son or daughter.
So, doctor, you did mention using an inhaler. What are some other asthma treatments that we should be familiar with?
So I think one of the most important things is that first, you definitely have to have a pediatrician, and you have to have or a doctor that takes care of asthma, and have a frequent follow-ups with your pediatrician or with your doctor. Second of all, you can use rescue inhalers that you can use that when you have an active asthma attack, when you feel you can't breathe. You can also use long-term inhalers, which are medications that stabilize your cells, called mast cells. Those mast cells are like little cells in your body that when they get in contact with the allergen, they break and they release something called histamine. And that actually is what makes you have this trigger and inflame and kind of close your airways. So you have those three things. One of the other things that we have also here in New York, you have the New York Health Neighborhood Program, which actually goes to your home for free and checks to see what triggers you have at home and educates you in these triggers. So it's very important to follow. First thing, as I always say, is just make sure you follow with the pediatrician, and your pediatrician can give you a referral for that.
Right. Thank you for that, doctor. And as we mentioned, preventative care is number one here when it comes to, asthma and any chronic condition you have, really. What happens if asthma is not treated properly?
So if you don't treat asthma properly, your lungs can suffer a lot, to the point that they can fibrose, and you can actually have very bad consequences from that, and you can even die. So that's why it's very, very important that you treat your asthma the right way, and try to minimize the asthma attacks so your lungs don't suffer. Every time you have an attack, your lungs, it's like you hit your lungs a little, when you hit them harder and harder and harder, and your lungs get stiffer and stiffer and stiffer. So you have to be careful with that.
Got it. And doctor, also on the same basis of preventative care, are there any activities that asthma patients should stay away from? Is there anything that asthma patients should not do?
I know a lot of people actually ask me about like swimming. Can we swim? Can we play any sports? And actually swimming is very good for patients with asthma. What's important is that where are you located, and make sure you're taking good quality air inside of you, and that you are well controlled with your medications and you're in touch with your pediatrician. You can do any sports. There's like exercise-induced asthma. So they will train you, they'll educate you. You have to be educated about what asthma is and how and what triggers your asthma, and your doctor will help you with that. So it's important that you keep that tight relationship with your doctor. Every time you go to your doctor, they will do like what's called an asthma action plan, where they will tell you, look, you need to use this when you're coughing and you feel tight. This is what you need to use all the time. And they make a plan for you. So it's always good to come to your pediatrician every certain amount of times, every 3 months, and make sure you review your asthma action plan and see how many times you've had an asthma attack, just in case we need to modify your medications.
I think I can safely say that I believe that everyone knows someone with asthma, especially living in the borough of the Bronx. I have various friends who suffer from asthma and sometimes forget their inhalers, and or they misplace it and they have to look for it. So we always have to remind each other, just remember your inhaler. Be careful with the way you run, and just take your time, breathe. So thank you, doctor, for these reminders. And before we go, Laura and Dr. Nunez, just provide us with any resources that there are out there for our viewers and asthma patients and anyone who would like to know more information.
Sure, Sonyi. So there's some great resources. Montefiore has a center right here in the Bronx for children and adults. The American Academy of Pediatrics is a good resource. The Asthma and Allergy Foundation of America and EmpireBlue.com has information that you can use as well.
Perfect. Thank you so much, Laura. Thank you, Dr. Nunez, for your time today. And thank you for sharing all this wealth of information and knowledge for our Bronxites.
Thank you.
Thank you for having me.
This has been the Empire Whole Health Report on managing asthma. We'll be right back here on Open BX RX Tuesday.